listener production.
Hey, Bension Siebert here with The Briefing. Over the past few years, Ozempic, Wegovy, Mounjaro and medications like them have revolutionised weight loss in Australia and around the world.
I have spent about the last 4 years trying to lose some weight, and last week I started on Wegovy, which is a GLP-1 medication.
These drugs are used for different purposes, as a treatment for diabetes or simply to help people lose weight. And they pretty much work in the same way, by making you feel full so that you eat less.
That food noise that we know only too well is non-existent, which is truly a godsend. If you know, you know.
In Australia, Ozempic and Wegovy are now approved for treating diabetes, and your taxpayer money goes towards subsidising that cost. But the Pharmaceutical Benefits Scheme has rejected funding them for weight loss. This means that people who are overweight but do not have diabetes are looking at hundreds of dollars a month if they want to try them to lose weight. On this episode of The Briefing, we're asking, is that the right call? Jonathan Karnon is a professor in health economics at Flinders University's College of Medicine and Public Health, and Lauren Ball is a professor of Community Health and Wellbeing at the University of Queensland. Lauren, welcome to The Briefing. Should taxpayers be paying for someone to lose weight?
That's a fantastic question, and it gets to the heart of some of the tensions we feel about the difference between an individual's responsibility for their health and our society's responsibility for our health. For someone who's concerned that their hard-earned tax dollars are being used for someone else's, say, weight loss medication, I would say to them that they're already paying for the costs that the healthcare system accrues because of these many weight-related chronic conditions such as cardiovascular disease, type 2 diabetes, and even some cancers. It could be argued that supporting weight loss medication, say on the PBS, would reduce the overall demand on our healthcare system and therefore reduce the amount of hard tax dollars going to someone else's health.
Could we just step back for a moment? How do these medications actually work in your body?
Yeah, there's several of them that work in similar ways, but essentially they help to improve the way that our body regulates its blood glucose levels. And we've seen the research in terms of its efficacy or effectiveness at inducing weight loss to be extremely high. And that's brought about not only through changes to someone's physiology, but also by reducing hunger and appetite and cues for eating. And so it's not surprising that there's pretty good consensus now among medical and healthcare professionals that these drugs do work for many people, and therefore we're seeing such an increase in the uptake of them.
Over the past many years, we've had things like the body positive movement. People might be listening to this thinking, hang on a second, haven't we sort of moved past the idea that being fat is necessarily being unhealthy? If you are fat and you eat well, exercise regularly, your other markers basically show that you're a healthy individual. Is it necessarily better for you to lose weight?
That's such an important point that you're raising, because we are now becoming far more better at talking about some of the stigma and the consequences that people in larger bodies face just by living their lives or even by seeking support in the healthcare system. We've seen recently a proposal to even change the way that we categorize or talk about obesity, saying that BMI, for example, is not enough, because we do see many examples of people in a larger body who are, other than size, very healthy people, and all the limitations that we know exist regarding body mass index. But the medication or weight loss drugs are really targeting the healthcare consequences that some people face as a result of being in a larger body. That's what this conversation is targeting.
What are those consequences? If we just say you're a person who is in a larger body, otherwise healthy, what could be the consequences if that continues?
There are several to discuss, but the main ones in terms of the cost we see in the healthcare system really are around chronic conditions such as high blood pressure, high blood glucose levels, which can lead to conditions such as cardiovascular disease and type 2 diabetes. It can increase the risk of some cancers. It can put greater strain on our musculoskeletal system and therefore make it physically more challenging to go about our daily lives. However, I should point out that we shouldn't conflate the issue of lifestyle-related chronic disease in terms of the food that we eat and the amount of physical activity do with just the merely by looking at someone's body shape or size.
This might be a larger question than can really be answered in a podcast of this length, but whose fault is it if someone is fat in our society?
It's a great question. And some argue that it is a naturally occurring change in our society that has been happening for decades or even several hundreds of years. The debate about personal versus societal responsibility for health has been going on for an extremely long time. Currently, there is very good recognition that our society is not helping us to live a healthy lifestyle. If you look at our food system, our jobs and our transport, the easy option is definitely not the healthy option generally for many people in today's society. However, when you look at the science and the evidence around how we can support weight management or healthy lifestyles, they are targeting individuals. And so the challenge that we face as communities and as society is how we grapple with that we're essentially expecting individuals to overcome or to take on these societal issues. And we can see just based on the changes in our shape over time that it's not working.
If it's the case that these medications would be broadly good for people's health, why aren't they on the PBS already? Why do you think they haven't been approved?
So my understanding is that the committee that assesses medications to go on the PBS has considered this before and it was not passed. It was not deemed to be cost effective. However, this is a rapidly changing area of research. Even as recent as a couple of months ago, there was new evidence from the US to come out that looks at health conditions amongst people who have used weight loss medication and the significant reduction that they've experienced in terms of, for example, fewer heart attacks, fewer cases of diabetes, even fewer cases of infectious conditions such as COVID and colds and flus that we don't always associate with weight. And so the thinking now is that if it was considered again, there might be a different outcome in terms of cost effectiveness.
I asked health economist Jonathan Karnon if he would put these medications on the PBS for weight loss.
I would if the price was right, and that's the key question. So they're definitely providing benefit, significant benefit to people who need to lose weight, but without knowing the price that they're being offered to the government, it's difficult to make a definitive yes or no answer.
What kind of costs are we talking in terms of both cost to the taxpayers or health system and costs to individuals trying to get this medication?
The cost to an individual currently to access these therapies is around $400 to $500 per month. And so treatment is ongoing. And so, essentially it's $400 to $500 per month for a good period of time. So if the government were to fund these drugs, you would hope that they'd be able to negotiate a lower price than that. But clearly, given the number of people across Australia who could benefit from these drugs, then the impact on the health budget is huge, potentially huge.
On the other side of that, stopping people from, for example, getting a heart attack, is that worth potentially the cost of giving people subsidised medication for this purpose, do you think?
The key word there is potentially. There's obviously costs associated with heart attacks and diabetes and other health conditions that would be prevented if these drugs were made more available. But I think it's important to note that those cost savings would be very unlikely to outweigh the costs of providing the drug.
For a long time in Australia's healthcare system, there has been a pretty strong focus on individual responsibility for those lifestyle factors that we've talked about. If we put a medication like this on the PBS, is it a tacit admission by the Australian government or the powers that be that lifestyle changes aren't as effective as maybe we thought they were?
I certainly hope that that's not the case. We have quite good evidence for the effectiveness of changing lifestyle to improve health, absolutely. We also have good evidence for the effectiveness of health professionals in supporting people to manage their health. And that's the reason why we have some of the existing Medicare programs that will see subsidised appointments with allied health professionals, for example, with dietitians and exercise physiologists. And that's for people who have lifestyle-related chronic conditions. The way that science is done is that it's easier to run a trial on a drug where it's easily controlled, easily managed, as opposed to the broader, more complex observations of how we live our life in the community, where it's harder to have a comparison group and it's harder to monitor all aspects and then put it in front of the committee to look at cost effectiveness. Certainly, if people were wanting support for lifestyle changes and were able to access that, such as additional support for allied health providers, that's also going to reduce costs on our healthcare system and be a good investment.
If I ask you to look into a crystal ball for me, and let's say that this does go on the PBS, there are presumably a very large number of people in Australia who could potentially be wanting to take this medication. What would we see as the impact of that on the health of Australians broadly?
So through these medications, if they were on the PBS, we may see reduced barriers for some people to access these medications, obviously primarily cost. But in order for that access to occur, it would require a conversation with a healthcare provider such as a GP, and that's still fundamental for these medications. And any decision that someone takes around taking these medications would need to be done in the context of a consultation with a healthcare provider. The hope would be that if these weight loss drugs were on the PBS, that we would see more people who meet the criteria for this medication to be able to access that and therefore better manage their own weight and health in a way that aligns with their values and their motivations. And based on the evidence, we would likely see a reduction in lifestyle-related adverse outcomes that are very costly to our healthcare system, such as heart attacks, such as complications from diabetes, even early death. And so overall, we could see a healthier and even happier Australia.
Finally, right now, Lauren, would you want to be paying for someone else's weight loss medication?
I feel like I'm already paying for the health of the society in which I live in. If someone is choosing to take weight loss medication and it's the right choice for them and they feel comfortable and they feel informed about the benefits and the risks to them, then I'm supportive of that, and that should not be criticised by us, commentating about that, but really should be a decision personally. So if I can support paying for someone else to have an informed and access to the healthcare that they want and need, then I'm supportive of that.
Lauren Ball, thanks so much for joining us once again on The Briefing.
Thanks, Bension.
That was Professor of Community Health and Wellbeing, Lauren Ball, speaking with me there. You also heard in there from health economist John Karnon. Thanks for listening to this episode of The Briefing. That's it for now. Before you go, though, we'd love it if you could share this app with someone you think might be interested in the topic. It's a really easy way you can support us and all we do here at The Briefing, as is sharing our social posts. Check us out on Instagram at The Briefing Podcast and on TikTok and YouTube. Just search Listener Newsroom. I'm Bension Siebert. Catch you next time.